your business waste in a safe and protective manner? Could you spend up to $500 on improvements to your shop? Well, the Pollution Prevention Assistance Program is here to help. PPA specialists offer free hands-on assistance to help businesses find and resolve potential pollution issues. Connecting with your local PPA specialist is easy. Just visit our website at ecy.wa.gov/PPA to find the specialist near you. This is a no-cost service to your business provided by cities and counties with funding from the Department of Ecology. Connect with us today at ecy.wa.gov/PPA. Sponsored by the Washington Department of Ecology and aired in cooperation with the Washington State Association of Broadcasters and this station.
News, sports, and information for the North Olympic Peninsula. We're Newsradio KONP, Port Angeles, Squim, a Radio Pacific station.
From ABC News, I'm Michelle Franzen. Russia stepping up airstrikes in southern Ukraine this week and fierce ground battles reported in the Bakhmut region. U.S. and NATO defense leaders in Brussels today discussing more aid and training for Ukraine. The U.S. announced another $325 million aid package. Chair of the Joint Chiefs, General Mark Milley, on Ukraine's counteroffensive.
They're in the early stages, and it's far too early to make any definitive assessments. But I can tell you that each day, the Ukrainians demonstrate the courage and tenacity needed to methodically regain their territory.
NATO allies training some 6,000 Ukrainian forces around the world. Americans will soon get to see the bottom line costs on many of those big ticket items.
You see it when you pay to see a concert. There's the ticket price, then all those add-on venue, service, convenience, and other fees you don't see till you get the bill. President Biden says the largest concert ticket seller is changing that.
Starting in September, Live Nation will automatically list all the prices up front.
SeatGeek, Airbnb, and others doing the same, but it does not mean anyone's lowering their prices. You'll just see them all at once when you click buy. Andy Field, ABC News.
A report by the Washington Post says long before former President Trump was indicted over his handling of classified documents, he had a chance of settling the case. Here's ABC's Justin Finch.
The Post says Trump attorney Christopher Kise wanted to quietly approach the Justice Department last fall to broker a deal that would avoid charges. The deal would have included returning all the documents. Trump was reportedly not interested. In the meantime, sources say Trump is narrowing down a list of potential new lawyers for the case, but with no court date set yet, they've been able to take their time.
You're listening to ABC News.
Have you Googled yourself lately? Are there negative posts from an ex-employee or from a former client? Maybe an outdated news article or sensitive personal information about your family? Search engines don't always get it right. For right or wrong, it's your reputation on the line. That's where Reputation Defender by Norton comes in. One of the most trusted names in online reputation repair, Reputation Defender has been fixing people's search results for over 15 years. Their cutting-edge approaches help you to wipe away unwanted information in your search results. They also promote the good stuff so that it rises to the top, helping you put your best foot forward. Your good name is too valuable to leave to the whims of a Google algorithm. Take control with Reputation Defender. You can start by getting your free reputation report card at reputationdefender.com or call 800-401-6681 to speak to an expert. That's 800-401-6681.
Parts of the Midwest on alert for poor air quality. The Minneapolis area, especially hard hit. That air quality in the city yesterday, the worst on record since 1980.
This all comes 1 week after this incredible haze that blanketed New York City, west to Detroit, and down to Washington, D.C. and beyond. Some of those spots hitting 400s on the air quality index. Now, we have not seen numbers that high or that bad this time around. But with those Canadian wildfires still raging, many are bracing for more smoke down the line.
ABC's Alex Perez in Chicago. An unusual ending to a death investigation near Houston.
The photos are gruesome. The body of a woman dressed only in underwear found in a bag in a wooded area. Sheriff Ed Gonzalez tweeted that, quote, foul play is suspected. But the first detectives who fully opened the bag noticed that there was no smell. It turned out to be an anatomically correct and very lifelike plastic silicone replica of a female, a sex doll. Sheriff Gonzalez's next tweet put it succinctly. False call on this one. Jim Ryan, ABC News.
A lot of us don't like Mondays, and now there's new reason for the Monday blues. British researchers say the most serious types of heart attacks are more likely to happen on Mondays than any other day of the week. Studies suggest heart attacks may happen more often on Mondays due to the change in sleep cycles following the weekend. This is ABC News.
Uh-oh, Brad's buzzed.
Oh, yeah?
Yeah, he's starting with the woots. And now a speech.
I just want to say that friendship is about heart and brain. Who's with me?
Good thing is, he knows when he's buzzed.
And my brain is saying, when it's time to go home, somebody call me a ride.
Love that guy.
Me too.
Know your buzzed warning signs? Call for a ride when it's time to go home. Buzz driving is drunk driving. A message from NHTSA and the Ad Council.
Michelle Franzen, ABC News.
End-of-life decisions are hard, be it pre-planning or having to navigate through the process suddenly. You need to have an advocate in your corner, which is why I wholeheartedly recommend Drennan & Ford Funeral Home and Crematory, the only locally owned funeral home in Clallam County. Their expertise ensures a smooth process so you can focus on the important things like healing and being with your family. Their help through the darkest time in my life will forever stay with me. Call 360-457-1210.
KONP News brought to you by RE/MAX Evergreen Real Estate. Outstanding agents, outstanding results. 457-6600. Clallam County's fire marshal announcing a burn restrictions in effect immediately. It's a restriction, not a total ban yet, until further notice. Referring to this year's unseasonably dry spring, the fire marshal said we're looking at maybe our most challenging fire season ever in western Washington, and predictions for precipitation in July and August are bleak at best. The burn restriction applies to all outdoor burning except recreational fires used for pleasure, ceremonial, cooking, or similar purposes. Recreational fires limited to 3 feet in diameter and 2 feet in height.
Here's your News Radio KONP forecast. A mix of clouds and sun this afternoon with daytime highs approaching 64. Northwest winds 5 to 10 miles per hour. Lows level off around 51 tonight. Mainly cloudy skies. Overcast tomorrow. Slight chance for scattered showers. High temperatures reach up to 62. Upper 50s Saturday. Low 50s by Sunday. I'm weatherology meteorologist Paul Trombley. Currently, it's 59 degrees.
It's the Todd Ortloff Show on News Radio KONP. Now, here's Todd.
And welcome to the show. We're going to spend the first part of the program today talking with the CEO at Olympic Medical Center. Daryl Wolf joins us. Daryl, good to have you in the studio. Last time we chatted, we were just remarking it was mid-pandemic and we were doing everything remotely. So it's nice to have you in the studio for a bit of an update on OMC.
Yeah, thanks for having me, Todd.
And I think that's where we're going to go with just kind of there's a lot of changes that have happened, and maybe we can use that last time we chatted in the middle of the pandemic as the springboard into where things are at today. I'll just remark that after you're done talking here, you're going to be meeting in a couple of forums about kind of some crisis, if you will, about where OMC is at, and it's healthcare in general, financially and all of that too. So maybe with that said, paint a picture for us as to what the status of Olympic Medical Center is and kind of what you're dealing with, what you're trying to get across to folks and maybe get through this.
Yeah, no, thanks, Todd. I think it's a challenging time for healthcare across our country. I was in D.C. Actually was in April at a American Hospital Association conference, and the statement made there was that nearly 60% of the hospitals in the United States are operating in the red, as we say. Mm-hmm. Never happened in the history of the American healthcare system. So these are unprecedented times. The last 3 years here at Olympic Medical Center have been very difficult. I do want to say, while I'm online with you, I appreciate all of the patients with patients, staff, and others that weathered that storm with us. It was very hard, and it took its toll on not just Olympic Medical Center but hospitals across our country. I can tell you that in the state of Washington in 2022, all but a handful of hospitals lost money. I think collectively, hospitals in the state of Washington lost $2.7 billion last year. So it's a tough time all around for all of us, and here at OMC we're not exempt from that. We had a tough year in 2022. We were fortunate to receive a lot of federal funding through the pandemic, which was good, but that has since run out. However, we've gone from a season where we were always reacting to the latest crisis through the pandemic, and we adopted a mindset that was like we did whatever it took. We stood up clinics. We did lab testing for a large variety for a large amount of the community. We did a lot of things, and not just OMC, but other local agencies as well, and worked together well. So we've had a rough 3 years, and now we're back to a time where through the pandemic the workforce has shrunk dramatically. I think most of us in healthcare the last few years had those moments where we're thinking, maybe there's something else, because it's been tough. It's been really hard, whether you're a nurse, a doctor, or you're just working one of our front office positions where you're interacting with folks who are frustrated about masking, vaccinations, and so on. It's just been tough. So from a financial perspective, that's where our focus is now, coming out of the pandemic. How do we look at this new reality, and how do we right size our organization to kind of the challenges that we have now, where reimbursement just isn't what we want it to be relative to the escalation of our costs. So.
One of the things that you are a public hospital, and I think maybe this is a good define for folks, because really, what we pay on that tax bill to the hospital district does not. I mean, it's not. That's not covering the nut, so to speak. Your revenue is coming from services, from being a business, more or less, right?
Yeah, no, that's a good question. I think the about 2.5% of our budget comes from our tax levy, which we greatly appreciate. I don't want to understate that, but I think that's about $5 million to OMC each year, but our annual budget's about $270 million. So it is it's helpful, but to your point, it's 98% of what we do is operations and within all the constraints that we have.
And then taking that back when you're struggling to get employees and trying to deliver services like any sort of a business, I mean, it can exacerbate your situation, I would think.
Yeah, no, for sure. And what we've experienced is, again, as I mentioned, the workforce shortage. We've had to rely on we call them travelers, which are contract labor. We're thankful that they're here with us and helping us out, but they are far more expensive than permanent staff that we're really working hard to find and bring to the peninsula. We have a great opportunity here. OMC will never be the richest place, but I think I was talking to one of our providers yesterday, and he said, he pointed at the water and he pointed at the mountains, and kind of said, and talked about the community. And I think that's what we're trying to. I don't want to say sell, because that's not the right word, but those are the tools we're trying to use to recruit and retain as to why you want to join Olympic Medical Center, why you want to be part of this community, because it is really a great place to live, and it is a great place to raise your family. And we are a great organization, and we're just having a lot of challenges right now, but we're not alone.
Yeah. I would think, and it's just hypothetically, in some ways you might be able to capture some folks who are burned out in a bigger city. I'm not saying that's your strategy, but that could be part of a strategy for some people. They may be looking for a break. They don't want to hang it up, but maybe do it somewhere else.
Yeah, no, I would capitalize on that strategy all day long if we can. But no, what we have seen is, and to your point, is as some of these traveling staff have rolled through, some of them have joined permanently, and I think. Through the pandemic, we had a lot of traveling staff, and many of them would spend time at OMC or and they'd say, "Hey, this is a pretty good place." And despite all the challenges that we do have, we're better off than a lot of our a lot of other folks, a lot of other facilities across the state and the nation. So that has worked a little bit, yeah.
What do you see as short-term fixes, things to consider? I mean, because I think people are hearing what you're saying and they're going, oh my gosh, how do we keep this place at least solvent enough that we can continue to have a hospital?
Yeah, well, I think we're in the first phase of what I'm calling a 3-phase recovery plan, and the first phase I'm putting simply as it's back to basics of management. We need to be watching overtime, talking about productivity, looking at our volumes. We need to be we're looking at. We have some debt as an organization. What's the best structure for that? So there's a lot of work going on, as we speak, to just get back to making sure we're managing the store the best we can, if you want to put it that way. Because I think during the pandemic we got into a crisis to crisis, and we weren't necessarily paying as close attention to those things because it seemed like we were always on an edge of some other thing that was coming our way, and so we really need to get back to basics. And so a part of the phase 1 plan we're looking at now is the things I mentioned, which are some kind of hardcore management items, as well as we have 2 startups. We had a changeover in our anesthesia group last year. We've had a changeover on our emergency provider group last year. So we have some, what I'm calling them startup costs that will be going down over time. In 2024, we're going to have some new funding from the Medicaid program in our state, which is significant to OMC. And so we have some good things happening and helping us, and so it's not all headwinds, but we do have quite a few. So there's a lot of efforts now along those lines, as well as trying to reduce our reliance on contract labor, which, again, we appreciate those folks, but really we want folks here, and that's the best way to run a business.
You've been involved at the hospital for a long time. I mean, I think the level of contract labor, you've never seen it like that before. No. I used to joke. I've been OMC for 16 years. I was the chief financial officer for several years. And when there was 1 or 2 contract laborers coming, I would kind of start pulling my hair out, and I'd give my predecessor a hard time. But now when we're talking, we've had as many as 78 of these folks at any given time, and so it's it's we've never done this before, so it's unprecedented in that way. But that's the way the workforce is being. That's kind of how we're holding everything together right now. And it's not just here. I mean, as you just mentioned, there's a lot of. I could probably talk to people in your position at other hospitals that are going to tell me similar stories.
Yeah, no, it is that is the case everywhere, and it's just the change in the workforce.
How hard is it to, I guess I'll use the word compete in having a public hospital as you do here with, you're surrounded by privately, held hospitals, whether they're, churches are involved with them and all of that. Tell us, compare and contrast that, what you can't do, and is it making it more difficult?
Yeah, that's a good point, and the answer is yes. I mean, as a public entity, we turn no one away. We whether you're going to one of our clinics, the cancer center, or the emergency room, we see everybody, whether you can pay or not. And so that's not necessarily the case if you're in a for-profit system. You can treat those folks. You can play that game a little bit differently. We don't have that luxury, and that's. And a lot of our funding, in this community, Medicare, Medicaid, which are the 2 main payment sources, those are government. We call them government payers, and no matter what we charge, they pay us the same. And no matter the intensity or the extent of the services, they pay us the same. So there's a lot of challenges being a public entity, but I think the mission is important. I think that's why we're here, and we're dedicated to that, and we'll continue to do all we can to continue to take care of everybody, because we feel like that's our job.
Right. You talked about changes that have happened. Certainly, we followed the issues with the ER and the emergency department. You've got a new, basically new company, if you will, that's running that under the contract. Tell us how that's going. A lot of concern, and I know the commissioners and yourself have been getting a lot of reports about, are we making it more efficient? Are we getting people in? Because that's been a big bugaboo for folks, I know.
Yeah, no, and I think if you look at the statistics in RER in terms of wait times, we're on the better end of that. I think similarly, whether you're, no matter where you are. Emergency rooms, especially in our state, because I'm mostly aware of those. There's no capacity anywhere, and I know I was talking to the CEO of Harborview probably 8 or 9 months ago. We were in a meeting, and Harborview had an additional 100 beds set up, and they had them in conference rooms, they had them in hallways, they had them in, and I felt slightly better about our situation. It's not perfect, but that said, the ER has been a focus, and I think the transition has been very difficult. But I think at the other end of this, we will be, we'll be in a good position. But it's still going to be difficult. Yeah. I think there's more patients than that we can handle at times, and I just appreciate everyone's patience, knowing that we're doing the best we can.
How much is this is still driven by people are using the ER for primary care because they can't get access elsewhere? I mean, is that still a big part of the reason for volume issues, perhaps?
Yeah, I think so. I mean that I don't have the data in front of me on that, but that's still a factor. For sure, we still have a primary care shortage in this area, despite the best efforts of our physicians division and North Olympic Healthcare Network and the Jamestown Clinic. We're the main primary care providers in the area, and as much as we do, we know there's still need for more. So there is some of that. The other thing that we're seeing more of, especially in the last few years, has been just folks that they're in the ER because there's nowhere for them to go. And they may not meet the criteria to be a true admission into the actual proper hospital, or hospital proper, I should say. But there's nowhere where them for to go, and so they're safe there, and they end up languishing there maybe longer than they should, because there's not a good place for them to go, whether they're suffering from some state of behavioral health crisis, substance abuse crisis, maybe they're just severely demented and they can't be cared for at home anymore by loved ones. There's all kinds of scenarios, but those folks also tend to stay in the ER longer, and that also kind of exacerbates the waits. But again, any hospital administrator you have sitting in this seat from this state will have that same story, and our challenges are, in fact, in some cases maybe even we're actually doing okay out here relative to some other facilities, despite it's still challenging, but the waits at other places can be far longer.
Talk to our listeners a bit, Daryl, about you're in a unique position in the size of your hospital, in how many beds that you're licensed for, how many you're actually using, and that I liken it to you're too small to be big and you're too big to be small, I guess might be a good way to describe OMC.
We're a tweener hospital, yeah.
And that causes some issues, doesn't it?
Yeah, no, that's a good question, and I think that there's small hospitals. There's small hospitals like our neighbors in Forks and Jefferson. They're what they call critical access hospitals. They have less than 25 beds. They have a different reimbursement structure. We operate 67 beds. We have the ability to flex up and down from that. But we're paid like the big systems. But we don't have open heart center. We don't have a cath lab. We don't do brain surgery and things like that. So we don't have those some of those high dollar things that can be helpful to organizations, but we're paid like them. And so we're what's called a sole community hospital, and that's if you look at hospitals across the country, it's a pretty small. Yeah. There's a pretty small group of us. So yeah, good question, and. Yeah, it does create its own challenges. We have some advantages, but we don't have the critical mass or economies of scale of a large urban center. But we don't necessarily have the safety net type of funding that some of the smaller hospitals do. So we're in an interesting spot.
Just a hypothetical, is it thought to license down as perhaps a way to get through some of this financial issue and staffing and all of that?
Yeah, no, that has crossed our minds, but I think as I sit here and talk to you, I think we have over 50 people in inpatient beds right now at OMC, and so that would be really difficult. I mean, let's say we were a 25 bed facility, and there's ways you can structure that where you have a few more beds than 25, but that's more transports, that's more sending folks to other facilities that have no capacity, and so I feel like that's the wrong thing for the community at this time. I think that would be option Z, if you know what I mean, because I think there's a way through this, and it's going to be good management, and I think it's going to be tempering services maybe at some level. We have a lot of services in Sequim and Port Angeles. So as we go forward, there may be some things that we look at as, do we need in both cities now? And I'm just throwing that out there as an example of things we'll be looking at in the months if we're not able to, we're turning over every rock, we're looking everywhere we can right now to find those savings. But but to shrink to that, to shrink that much would be, that would be very, very difficult. I'm not sure how we would still care for our folks the way we think we need to.
You talk about transfer, that still happens quite a bit because really you alluded to this, you're set up at this hospital to be, not able to provide some services people are going to need,
Sure.
especially in their critical care sort of situation. But that also, I think we learned especially in the pandemic about just how much this is a system. It's not just Olympic Medical Center, but, this past winter, it wasn't just COVID. There was just a lot of respiratory things going on. There was no place to take people because other places were struggling like you, and they were already full too.
Yeah, that's still the case today. I think, and I think it's worth noting that we actually accept, transfers from Forks. So they rely on us to some level. Obviously, there's the I-5 corridor. There's other centers they can go to, but we have a proportion of our admissions that come directly from Forks to Port Angeles, and we have a little more capability. We're a little larger. They do a great job, but they're fairly small. But that's the system's at capacity, right. And I think across the country that's what's going on, and I think the workforce shortages has just closed beds. There may be plenty of beds in certain places, but if you don't have enough, doctors, nurses, respiratory therapists, et cetera, it's hard to take care of folks, and so it's the ability to transfer. In the past, that wasn't as much of a challenge. We had more capability. That's not fair. There seemed to be more capacity across the water, right, yeah. and that's just evaporated. And I think the same can be said for our friends that work in nursing facilities, memory care. Everyone has this workforce challenge. So if everything was staffed 100%, it may be a different discussion, but it's not. And so they have the same workforce shortages as we do, and so I think this overall capacity has been constrained at a time when it's really needed, but everyone's doing the best they can.
How many, I don't know if you know the number off the top of your head, how many openings do you have right now at OMC roughly? You just give us a round number.
No, I don't. I think it's about 270.
It's a significant number of folks, and it's been at that for a long time, actually.
Yeah, it's crept up over time, and it's kind of all over the board too. Right. We're whether it's folks for accounting or IT, those aren't, we don't need as many of those, but as many as nurses and respiratory therapists and others, so the bulk of the open positions are for clinical people, and that's part of that contract labor piece I mentioned earlier. You got about 70 of those folks that ideally we're posting those positions to fill them.
But you're backfilled with contract folks.
Yeah. Right. And then you've got a lot of people that per diems. There's a lot of other things they're looking at to try to fill holes. And so just even if people can come in and work a few shifts here and there in certain areas, we're willing to take them. So we have a lot of postings, and the recruiting team. They're doing everything they can. They're getting as creative as possible. We got new billboards. We're again trying with some new strategies to try to really sell the area and the community and Olympic Medical Center as to being a great place to not just work, but a great place to live. And so getting as innovative as we can, or being as innovative as we can in those areas too, to try to attract folks, because I do think we have a good opportunity here.
One of the big issues I do know is housing. And I know that you personally there have witnessed where you've brought in a provider and they've, said, after 3 months or so, we just can't find a place to permanently land. So that, if you could talk to that, and then are you still in discussion about perhaps coming up with some ways that OMC plugs into creating some housing? And there's some places that actually look at trying to, I call them dormitories, but that's not the right word, but like some sort of a semi-temporary housing for providers or for people that come on.
Yeah, no, that's a tough one. I think we try when folks come in, we try to connect them with the right resources locally to find housing. And I don't know the stats, but I think that's loosening a little bit. I don't know how much. I haven't heard that story as much lately. but that doesn't mean it's
Perhaps
still
that's
there.
good news then, yeah, right.
And I think that, this is a community challenge, and I think every industry is looking at housing, and we're willing to participate, but I don't know this is something OMC is going to solve by itself. So
Right.
we do participate with other agencies, and we'll participate and try to be a part of that. But as far as us building an apartment or a dormitory or anything like that, one thing I will say is when the word went out a couple of years ago in the pandemic about traveling staff, and the public was amazing in their response. And I think we still have a list of about 30 or 40 folks out there willing to rent rooms and garages and anything like that. So we're still looking at those. So thank you for those folks that have done that, because that helps. That helps because a lot of folks, they move, they want to try out the area. So having some temporary housing like that is really nice, and that helps them figure out like kind of where do you want to settle? Do you want to live in Joyce? Do you want to live in Sequim? Do you want to live in whatever? So yeah, big problem. I wish I had an answer to that one, but we're happy to be part of any solution. But I don't know that we're going to solve that one on our own, and we're just trying to connect people with the right resources to help them the best we can.
For the public, I know you're doing some outreach, you're doing some other things like that. Any messaging for folks that they've heard what you've said, and maybe they've got some ideas, or maybe they just want to hear more?
Yeah, no, I would ask for folks to have patience and give us grace, knowing that any healthcare person you're interacting with today has had a long 3 years. Be patient. They're trying hard. I was talking to someone the other day. I said we haven't closed for 1 second in the last 3 years. We were always there. Our staff has gone above and beyond 24/7, and so please keep that in mind as you work with our system, and please know that everyone's doing the best they can, but we do have some severe challenges. The other thing I would say is, we are looking at some we're having community forums this week. We're going to have some more that are going to be more public facing. Yeah. And please participate. We want your ideas. But know that we do have we're doing the best we can in a tough situation, and we are this is our focus. Our board, myself, our senior leadership team, we are focused on remaining an independent, locally operated hospital. That's job one, and we're going to do everything we can to continue in that tradition. And so I guess those are a few things I'd add in, and just know that we're working day and night to make that happen.
Daryl, it's great to have you in the studio. Thanks for coming down, spending some time. We won't wait, a couple of years or a pandemic to get you back. How about that?
Happy to come back.
All right.
Happy to come back.
That's Daryl Wolf
Todd.
there. He's the CEO at Olympic Medical Center. We're going to take a break and be back with more on our program after this.
This is the Todd Ortloff Show on Newsradio KONP.
Red Carpet Car Wash in Carlsberg salutes our military veterans, active duty, and first responders each and every day. This isn't a special or a one-time deal. 365 days a year, Red Carpet offers 10% off all services to this special group. Please let them know who you are so they can honor you. And for Purple Heart recipients, you'll receive a free wash anytime, every day. Please accept our appreciation for your service and sacrifice. Red Carpet Car Wash, open Monday through Sunday, 8 till 5.
Celebrate Dad with Father's Day savings throughout the store all weekend long at Coastal.
Coastal Farm and Ranch, we're just what the country needs.
It's Father's Day weekend. This year, instead of a tie or last-minute greeting card, get him what he really wants at Coastal, like Ariat Work and Western jeans. Buy one, get one 50% off for Father's Day. Save $300 on a Kodiak 46 gun safe. Does Dad like to cook? The Grozny Rock Box Pizza Oven is $100 off. Plus, save on mowers and power equipment, gardening supplies, fishing gear, smokers, and more. Stop by and enjoy the Father's Day cookout Saturday from 11 to 2. Just 50 cents gets you a burger and drink, limit supply. Discounted pair of Ariat jeans of equal or lesser value. Celebrate Father's Day this weekend and sign up to win a new Honda Rancher ATV at coastalcountry.com.
Coastal Farm and Ranch, we're just what the country needs.
Serving Clallam County from Bell Creek Plaza in Sequim.
If you're an avid DIYer or builder, it's a necessity to have the right tool for the job. Makita and Milwaukee Power Tools have more than 200 right tools for the job, all running on their own battery platforms. That means a battery from your Makita or Milwaukee drill will also fit the battery to your same brand circular saw, leaf blower, grinder, or any of the other 196 tools they make. At Angelus Millwork and Hartnagel's, we stock the largest selection of Makita and Milwaukee power tools in the area, and we'll back it up by matching any non-promotional advertised price. These are not the power tools of 10 or even 5 years ago. The technology has grown to allow for greater power, longer battery life, and greater versatility. If you haven't handled a power tool in a while, we invite you to come on in and try one out for yourself. Make your next project that much easier with a Makita or Milwaukee power tool from Angelus Millwork and Hartnagel's. Angelus Millwork and Hartnagel Building Supply, building homes, building community since 1906.
Neighbors, the next generation, our community.
The chance to rebuild and thrive belongs to everyone.
United Way of Clallam County is committed to improving the health, education, and financial stability of every person in our community.
With our partners, donors, and advocates, we've reached more people to make a bigger difference in Clallam County.
Give for a brighter future. Advocate for a better tomorrow. Volunteer to make a positive change. That's what it means to live united.
Join us in making an impact in our community by donating at www.unitedwayclallam.org/donate.
Clallam County, Bathfitter makes a money-saving double play, and you get the win. Now get $750 off and no interest or payments for 18 months. In one day, Bathfitter can give you a beautiful walk-in shower or popular tub-to-shower conversion. With over 30,000 local remodels, Bathfitter Northwest is the peninsula's tub and shower expert. Turn a money-saving double play with Bathfitter Northwest. $750 off, plus no interest or payments for 18 months. BathfitterNW.com.
Stick out your tongue and say, ah, it's the craziest thing you ever saw. Here at Olympic Game Farm, they say howdy with a wave of a paw. Now it's hard to steer clear of the elk and the deer when they pop in to say hello. They've got lions and tigers and bears. Oh, don't forget about the buffalo. It's impossible to stay calm. So come out with your dad and your mom. Canine and feline, you'll find us online at onlygamefarm.com.
I was scared the night you overdosed, but I was prepared. I brought naloxone with me, and I knew how to use it. I held your hand tight when you woke up because I wanted you to feel safe. Your life is worth saving, friend, and I would save it again if I had to.
Naloxone can reverse an opioid or fentanyl overdose. Carry it with you. For more info, go to preventoverdosea.org. A message from the Washington State Department of Health.
Happy 60th anniversary to Coastal Farm and Ranch, and we have teamed up with Coastal to give away some amazing prizes, including a free Ford F-150 truck. Yeah, that's true. You have to register to win, but on the line is that Ford F-150. Also, they have a 2023 Honda Rancher ATV, a trip for two to the 2023 Wrangler National Finals Rodeo in Vegas, including airfare, hotel, and tickets, and a bunch of Coastal $100 gift cards given away every week. If you want to win, it's easy. Visit the website coastalcountry.com, coastalcountry.com, and you can enter every week for a better chance of being a big winner. And congratulations to Coastal on your 60th anniversary and for allowing us here at KONP to be part of this big, super fun giveaway. We'd also like to thank some great partners in the giveaways: Carhartt, Georgia Boot, Ariat, Wrangler, and DeWalt as well. It's Coastal's 60th anniversary. Go to coastalcountry.com, sign up, and you could win a new Ford F-150 4x4.
The Port Angeles Fine Arts Center invites you to the Summertide Solstice Art Festival. Celebrate the addition of new artwork and poetry to Webster's Wood Sculpture Park. Enjoy live music in the meadow, nature art stations, poetry readings in the courtyard, and local food and drink vendors throughout the afternoon. The Summertide Festival is free and for all ages. Join us on Saturday, June 17th from 1 to 5 p.m. at the Port Angeles Fine Arts Center. To learn more, visit our website, pafac.org.
When purchasing a home or land, nobody wants to inherit existing debts or legal issues that could interfere with their property rights in the future. That's why it's important to work with local title insurance professionals and protect your rights with owner's title insurance. Olympic Peninsula Title has been protecting the property rights of Clallam County customers for 35 years. Put our team of professionals to work for you. For title insurance, contract collections, and escrow services, opt for Olympic Peninsula Title.
For the Washington State News Network, I'm Michael McDonald.
Washington State is taking action to make breast cancer exams more affordable. A new state law requires health insurers that cover certain breast cancer exams, including MRIs, to not require patients to share the cost on those tests. That also includes diagnostic mammograms and ultrasounds for anyone if cancer is suspected. A Spokane man is being sentenced to 51 months in prison for a firearms offense. Frederick Durrell pled guilty to being a felon in possession of a firearm December of 2022. Court documents say he took several videos of himself holding a pistol at a shooting range and sent them to his partner as a possible threat. Due to 7 prior convictions of domestic assault, Durrell was prohibited from possessing firearms. He was arrested and will now spend over 4 years in prison. And the Washington State Department of Health urging all residents to donate blood. World Blood Day is intended to boost supplies in blood banks during a traditionally slow time for donations. During summer, vacations and people enjoying the outdoors cause blood donations to drop quite severely, but the demand actually goes up. All blood types, along with plasma, are needed. To find out where you can donate blood, log on to www.redcrossblood.org. For details on these stories and others, download the WSNN mobile app or visit WashingtonStateNews.net.
Here's your News Radio KONP forecast. A mix of clouds and sun this afternoon with daytime highs approaching 64. Northwest winds 5 to 10 miles per hour. Lows level off around 51 tonight, mainly cloudy skies. Overcast tomorrow, slight chance for scattered showers. High temperatures reach up to 62. Upper 50s Saturday, low 50s by Sunday. I'm weatherology meteorologist Paul Trombley. Currently, it's 59 degrees.
All right, welcome back to the program. Going to spend the rest of the show today. It's a Thursday. The last part's always dedicated to our business bits. That's when our business guru, Kevin Holt, comes in. And KevinYourBusinessCoach.com is his website if you are so inclined to go check out what he's talking about. And we are talking about coaching today.
That's right.
On the segment. So, Kevin, good to see you again.
Thank you.
I'll just lay it out there as you did to me in your notes. Coach, advisor, or consultant, which should I choose?
Which should you choose? and what do they do? And the point I raised at the very beginning of this was Tom Brady has a conditioning consultant. Tiger Woods has a swing coach. Taylor Swift still takes singing lessons. And they do that because even those people on the very top of their market need to stay on top, so they're constantly trying to improve their skills. So today, coach, advisor, consultant, what's the difference between these practices? Which should I choose? How do I know I have a good match? And of course, how do I get the most benefit from the time and money I spend with these good people?
Okay. So
we'll start with what's the difference.
Yeah, I want to know why I can't call you coach, or exactly. I should call you coach.
Yeah, please do, and I'll get a little bit more of that in just a minute. But a coach helps you see what you can't see. And we usually do that by asking questions. Now, that doesn't mean I haven't had a SBDC Business Advisor summary sent out where we ask our clients, hey, how did it go? And then they respond back, and one responded back by saying, why does he ask so many questions? Doesn't he know anything? And, of course, I don't know. I'll let others be the judge of that. But the answer, of course, is I need to know about you. And the way we find that out is questions. In fact, if you hire a coach and they don't drive you crazy asking questions, you might have made a bad hire. But the most important thing is we do not do the actual work. We help you see why your approach isn't working and how to help you build the skills to get where you want to be. But if we did the work for you, then we'd be a consultant, and we'll talk about that in a minute. So life coaches, well, they help you with personal and family dynamics. Executive coaches, they usually focus on leadership. You know, how to pull your team together, how to get your team all pointed in the same direction. Business coaches, we usually focus on your management mindset. Your vision, are you seeing all the things that are happening in your company, and are you relating those things to the actions that you need to take? You had a nice interview with the young lady DiPolito, who did a little time in prison. Yep. Elizabeth Holmes just went to a little internment camp in Texas, and they got internment or incarceration coaches that taught them about what's going on in the social fabric of the prison they're going to go to, and how they can work with that. So I think Martha Stewart had one too. So we're out there and we cover a lot of different areas. So what's an advisor? Well, I was a business advisor for a while, and an advisor helps you using our experience to help you with something you're currently facing. So again, generally somebody calls the SBDC, the Small Business Development Center, because they just ran into a roadblock. And they're like, whoa, this isn't working. I need somebody to walk me through, talk me through how I get through this. And we do that by giving our expertise and guidance. Again, the SBDC, when they hire you, they want to know, well, what businesses have you run? What's your educational background in business? And that's how they make their choice when they hire candidates. So an effective advisor can help clients access information that they didn't know about. This is one of the fun things about being a business advisor, if this is your thing, is that if you like taking in a lot of different information, reading, checking, learning, finding out new things, then you meet clients that have those needs. And first, you can connect them with that information resource. And second, you can show them how to apply that information to the challenges that they're having. So again, lots of different flavors. A financial advisor will look and find out about your personal goals. And then they'll recommend some products that'll help you get there financially, or whatever their sales manager told them to sell you that week. No, that's not what they do. And then a business advisor is going to connect a business symptom to some issue in the business model. Advisors generally recommend corrective or developmental action. So a coach is helping you with your vision, helping you see things, and helping you develop the skills you need to be successful in what you want to pursue. An advisor is going to answer your questions and make suggestions, recommendations, give you some developmental nudges to say, hey, you need to build up your strengths here, you need to work on this over there, or you need to stop doing that. A consultant does it for you. That's most people have that pretty clear, is that that's somebody you choose from a group who often bid on the opportunity to provide this service, and then they help you get the results that you want by doing the work for you. And that's very common in things like change management or redoing a business model or taking on some other a merger and acquisition. Mm-hmm. Company A buys Company B. Well, we've got some duplications and we have some gaps. So how do we put all these together? This is very common when a company doesn't have that expertise. There's something that happens. Right. They run into, well, we don't have anybody that knows how to do this. We might not be able to hire somebody on staff. So we bring in a consultant to just fix it. So they'll learn about your problems or your goals. And if they're a good consultant, they'll lay out a plan for you. And they'll say, hey, this is where we are. These are the gaps and challenges I see. This is what I'm going to do to solve it. And this is where I want you to come out on the other end. So you can kind of follow along, make sure you're getting what you were paying for. A consultant does the work you can't do because you don't have either the money or the talent to have it there.
And they're not going to spend some time developing that talent in you. That's also the other part of it, like a coach might. I mean,
exactly. Yeah. In fact, they'll probably do the opposite because they don't want to give away their gig. It's
point.
Like, I do this for a living, so I'm not going to tell you how to do it. You go see a dentist, they don't tell you how to do dentistry.
I always have a site whenever I hear the word consultant, just a little side bar here with in broadcast, especially when I worked in television. There was the consultants would show up.
Yes.
And there was always the memo would come along, and then, it was just, because they always had a plan.
Well, and
it involved, you're not going to do this show anymore. We're going to have you do this, and we think your hair needs to be like this. And you need to wear
exactly right.
You need to wear more blue, not red. They would.
Oh shoot! What about green? I'm in trouble now. Well, I was a sports host I listened to who's out of L.A. I listened to him on the internet, and 1 month, the guy was just screaming all the time. Everything he said at the top of his lungs, and I'm like, well, that's not what he's like. But it came out, I was reading in the press that a consultant had been there, said, hey, you're doing overnights, you got to keep people's attention, you got to drive those points home. And it was miserable. Couldn't stand it.
That's just broadcasting.
Yep.
I'll just tell you that. Most of them do end up giving you really not the best advice, but management loved them.
I have had people tell me there are people who couldn't make it in broadcasting, so they went into consulting.
That's a good point. All right. Back to you.
Yes.
So what are you, Kevin?
Which one is Kevin?
Yeah.
Well, early in my career, I started as an in-house advisor because I had some very specialized expertise that my employer wanted, and so I was very happy to take that job. Later, I was recruited by a consulting firm to be a consultant who worked for assigned clients. So it's, this company The one example, without getting too much detail, the company did a lot of work with heavy equipment, and they had a cash flow shortage. And my boss called me and said, I got this guy with an iron addiction. He just never saw a piece of equipment he didn't like, so we need to run him a financial analysis and show him which things to sell. And so that's a very direct, outcome-oriented activity. And then after that, I was recruited by the Small Business Development Center to be a business advisor. I had a pretty deep experience with small business, and they wanted somebody to come along and do that and also open some new centers for them. So that was very exciting. Now, I'm a business coach, kevinyourbusinesscoach.com, and that's for two reasons. Now, the first one is philosophical. Coaching is by far the most difficult of those three things to do. It takes a lot of knowledge and a lot of patience, most often achieved later in life. And I am certainly later in life. Yeah. And so the idea there is that you've got enough experience to working with people to know how far you can push somebody, when you need to get back off and let them gather their own steam. So that part is the most appealing by far. Plus, we don't do the work, so who wouldn't like that? Yeah.
Right. Yeah.
The second reason is purely practical. In advising and consulting, the practitioner is giving direction and making recommendations. These actions create professional liability. People can sue you for that. You told me to sell, and I should have bought. So that requires errors and omissions insurance, and that's pretty expensive. And so to carry that kind of coverage, I would have to charge a much higher fee. So as a coach, I still need insurance, but that coverage is much more affordable, and that makes it possible for me to keep my fees Port Angeles friendly.
Good point.
Consultants generally have to fly all over the country to find the gigs where they can charge the fees that they need to charge to support their costs. Yep. So you can do it that way, or you can, if you're old like me, you can say, hey, I've got enough experience to be a coach. I can just help people see things.
Coaching can be kind of fun, though,
in
some ways,
absolutely
because you're
is.
actually allowing people to, find their own skills, emerge, all of that.
I was privileged to be a Small Business Development Center advisor coach before I retired, where new advisors would spend some time with me so that we could kind of talk them through what this is going to unfold like for them. And it's incredibly rewarding to see them grow into the role and take on a client base and experience some successes. It's really awesome.
Okay, so, but still, there's a need, and you've just alluded to it into defining these for each one of these. So take us through how, if you've got a business or planning a business or where you're at in life, which one do you need? Where do you go?
Maybe you need a life coach. How do you know that? And so which one do you choose? And so, again, we just go back to the definitions. Are you feeling stuck? Are you encountering situations where you just run out of vision to see your way past these roadblocks? Whether they're personal, business, or otherwise, you should probably choose a coach. And first of all, it's a great place to start. That will build yourself up, because you've taken time to think about the problems you want to solve. Hopefully you're solving the right problem, and so you're going to address it with this matrix. Now, if you're facing a specific problem, I've got to put away enough money for my 2 kids to go through college, or I am suddenly facing a change in my supply chain. How do I keep goods in stock? Or the last 3 people that came into my store told me my prices were too high and they'll never come back. What do I do? And so that's an advisor. You need somebody to give you information you didn't have before and show you how to apply it to the business you have. If, on the other hand, you are like the Port Angeles City Council and you need to find out more about homeless relief, you don't have any expertise in this.
You don't have a person that does that, right?
So and it probably wouldn't make the taxpayers too happy if you put somebody like that on the payroll, because this is hopefully a temporary problem. So in that case, you would get that consultant who would do some primary research. They'd develop a report. They'd provide data that can be used for decision making or policy development.
And so what, there's going to be a product that's coming your way at the end when we start talking about bringing in the not the consultant, but the the consultant, not the advisor.
Yeah,
difference between an advisor and a consultant. That's what I'm trying to say.
Yeah. The advisor is going to come in and say, well, these are the sorts of things that other people with homeless problems
you
are
might try
doing.
this.
Right.
Move on.
Right.
Right.
The consultant's going to say, I talked to 450 homeless people in your town.
Right.
These are the needs they've expressed to me, and this is how these needs are met. So you would do the same thing if you want to find whichever one of these three that you would do when you're looking for a dentist, is talk to other people who've had these challenges. Talk to other offers. Look at their websites. Look at their brochures. What do you think of the promises that they're making for you? Is that something that you would like to see happen? So then move forward, give it a try, and see how you like it. Now, how do you know if you made a good choice? Well, very quickly, did you ask? About a third of the people that I've worked with have started the conversation with, how do I know you can help me, and how do you know you can help me? And my honest answer is, I don't. But let's take 20 minutes and talk about it, and we'll see how we do it. Also, are you moving forward? You brought this person on board to help you. You are getting where you want to go, or are you not getting where you want to go? And then finally, how are they charging you? You know, I tell my clients, if you don't like what I did, don't pay me. You know, we'll just part as friends. My only expense was my expertise. There's no charge for that. So how are you getting there? Now, the last thing, how do you get the benefit? Well, be sure you're ready to learn new things. You know, Winston Churchill said, I love learning, but I don't always like being taught. So make sure you're ready. Most of the Gordon Ramsay Kitchen Nightmares businesses flopped later because they weren't ready for that, and they went back to their old habits and failed. Also, participate, ask questions, push back. We like feisty clients. Take us on a ride, because that means you're in the game. You're not just sitting there staring into space. Trust your gut. Kevin's famous saying, nobody ever came into my office and said, I'm so sorry I trusted my gut. But they often say the opposite. You know, I wish I'd have trusted my gut. So next week, it's summertime. We're going to talk about networking.
Oh, yeah. Perfect time to be networking.
Major networking opportunities. And I'm going to answer the question everybody asks on the North Peninsula. Why should I network? Everybody knows me.
Right. Kevin, it's always great to talk to the coach.
Thank you.
I can call you Coach.
You most certainly can.
Yeah,
Coach Kev is
Coach
here to help
Kevin.
you.
And if you would like more of info about all of the things Kevin talks about, do go to kevinyourbusinesscoach.com and be here next Thursday.
Looking forward to it.
All right. That's,
Thank you.
Kevin Holt right there. Thank you for joining us. Thanks to Daryl Wolf in the first part of the program today, talking about what's going on with Olympic Medical Center. And we will take a break and check in with ABC News coming up at the top of the hour. Then the Dave Ramsey Show comes your way right after that. Stick around.
This is the Todd Ortloff Show on News Radio KONP.
Red Carpet Car Wash in Carlsberg salutes our military veterans, active duty, and first responders each and every day. This isn't a special or a one-time deal. 365 days a year, Red Carpet offers 10% off all services to this special group. Please let them know who you are so they can honor you. And for Purple Heart recipients, you'll receive a free wash anytime, every day. Please accept our appreciation for your service and sacrifice. Red Carpet Car Wash, open Monday through Sunday, 8 till 5.
We're the talk of the peninsula. News Radio KONP, Port Angeles Squim, FM 101.7 and 101.3. A Radio Pacific station.
Hi, I'm Mercedes. And I'm John. We are Foghorn Olive Oil Company. The Mediterranean diet is one of the healthiest diets because of olive oils and balsamic vinegars. At Foghorn Olive Oil Company, we have the most recently produced, delicious, and healthiest olive oils and balsamic vinegars with over 60 flavors to taste. And here's an easy way to remember our names. Everybody wants a Mercedes, but everyone needs a John. Come see us in downtown Port Angeles.
And now a word from our sponsor, the Todd Ortloff Show, Sapor. In addition to the fine dining experience and the bistro at Sapor Restaurant in downtown Port Angeles, there's the Trap Door Club. They offer the best in craft cocktails in a cozy, romantic atmosphere. At Sapor, fresh also means local. Sapor is focused on working in partnership with our local farmers, foragers, vintners, growers, and fishermen to bring you quality that can only come when it's local. If you want to join Sapor in this partnership, do give them a call. Contact them today. And you can also experience support right here on the TO Show, where I will be giving away a support gift certificate every week. Yeah, support underground in Port Angeles, open 7 days a week from 5 to 9 p.m. Friday night and weekend reservations are strongly recommended. Check them out now at Facebook or online, or give them a call, 360-417-6929, 417-6929.
Do you know when your septic system was last inspected? Clallam County Environmental Health keeps those records and can tell you. Pumping your septic and complete septic inspections by licensed professionals are two very different things. State law requires inspections every 1 to 3 years, depending on the system you have. Get more information about your septic system and inspection requirements by calling Clallam County Environmental Health, 360-417-2258, or by logging on to clallam.net/septic.
It's time to play Perfect Food Pairings, brought to you by Mountain Dew. This dish pairs perfectly with the bold citrus kick of Mountain Dew.
Oh, street tacos.
Sorry, that is not the answer we're looking for.
Flamin' Hot Cheetos.
Sorry, that is also not the answer.
What the heck?
Is it chicken wings? Correct.
What? Wait a second. Yeah, hold on. Mountain Dew pairs perfectly with street tacos. And Flamin' Hot Cheetos. This show is so lame.
The show is not lame.
Yeah, you're lame.
Nothing pairs perfectly with food like Mountain Dew. Do the Dew.
Welcome to Volunteer Spotlight, sponsored by Jim Hagwood of Port Angeles Realty. This is Alan Barnard, and this volunteer